Hey, everybody, and welcome back to All Things Pink. And today we're going to continue our discussion on menopause with part 3. And today we're talking about treatment.
Out in the open, to the horizon, where your heart can finally breathe. Out in the open, to the horizon, baby, let your love run wild, wild, wild. You gotta get out there and explore, baby, let your love run wild, wild, wild.
Hey, guys, welcome back for part 3. I'm really excited to have again with me Miss Christina Brockett. These conversations continue to get more and more interesting. So I want to start by kind of parlaying into like what we said in part 2, and you said something really interesting about mixed messages about it being okay to be in this stage of life. And we've actually talked a lot about social media
Mm-hmm.
and the messages that we're all receiving and misconceptions. And one of the things that I find to be super frustrating, I know for myself, is everybody would love to look like they did or feel like, or maybe, I don't know, maybe you like lost a ton of weight in your 20s or 30s and you feel better now. That's amazing. I do not. And I'm okay with it. But I will say that's like such a frustrating thing to kind of wrap your head around that. And it goes with that stigma, it goes with all the things that we've been talking about, like where we got to the point that we have to worry so much about our looks, that things like this that you have no control over are going to mentally, screw with you. I mean, the menobelly, right? That goes
Mm-hmm.
into the cortisol and all of that. But what is that mixed messaging that we're getting, and where should we be focusing?
I think the mixed messaging out there, right, is like you have people out there that are like, I'm in menopause and it's okay. And we're having these open conversations. And then equally so, you have women, and this is good, right? I'm not saying it's not, that are very, very strong. They're working out in the gym and they have at 52, 54 amazing bodies. Like they look strong, they look healthy. Don't let menopause get you down. You don't have to. And the reality behind all of that is that there's that mixed messaging again, right? Like I don't have to settle, but it's okay. You're also in this stage of life. And I think this is kind of like, and I'm going to liken it to pregnancy, right? You're pregnant, your body, you have no control over what's happening to your body.
Yes.
You're gaining weight, things are changing, your emotions, how you feel is all over the map. And some women approached, when I was pregnant with my kids, pregnancy as in a free pass. I'm going to eat whatever I want. It doesn't matter. I'm gaining weight. It's fine because it's
Yeah.
pregnancy. Now that, or you could view it as this is a stage of my life. And yes, I have no control over my body, but I'm going to eat for my health and the well-being of my body and of that of my
Yeah.
child. And I think that's where and I laugh because I think of the conversation I had with my orthopedist regarding my knee. I'm like, can I? And he is like, listen, this is a part of aging. You know what I mean?
Yeah.
Like, sister, you're getting older. This happens. Your joint breakdown. You know what I
Yeah,
mean?
it
Like this is
does. It
just
does.
life. There's only so much you can do. That's not to say that you don't maximize your health in whatever way
Yes.
is appropriate for you, because I think that there is something to be said for feeling comfortable in your own skin, for being comfortable. You talked about like
Yes.
being able to feel comfortable. Does it mean that you look like when you were
No,
25?
because I
No,
do not.
but
But yeah, like
you
so,
feel comfortable.
and the reason for wanting to change the diet and to maybe exercise just a little bit more, add some days, is because I was not comfortable. I felt like crap. Like, so I'm like, it was more, and yeah, of course I'd be like, yeah, I want to look exactly like I did. And I was able to shrink several inches, but but the goal was really in essence for me to feel better.
And that is really where I am with, like, when I talk to women that come into my office about, we're going to do everything we can right now to maximize your health and well-being, but understand that there are certain factors that you cannot fundamentally change. Like,
It's
you
okay to accept those too.
you can accept them, and you can work the best and be the healthiest you can possibly be where
Yeah.
you are. It's just like your genetics, right? I've had these discussions. I've been working out with the same trainer for, gosh, since 2012, 2011, 2012, somewhere in that
Mm-hmm.
mix, right? And we have these conversations, and he's like, I have people that come in, they're like, well, I want to be able to do X, Y, and Z. And he's like, okay, you're not Simone Biles. Like, you will never be
Right,
Simone
right.
Biles. He's like Michael Phelps. Like, there are people that are genetically predisposed to certain body types, certain metabolism, certain composition, that's not to say that you can't be the healthiest you, given
The
your
best version of yourself.
the best version of yourself. But that ultimately, I think, is where we strive for in terms of longevity and health and
Yes.
well-being versus, where we are. And I also think that at this stage in our lives, it's about knowing yourself and being comfortable with yourself to say, you know what? I'm not feeling a rough workout today. I need to be gentle with myself. I need to be gentle with my
Yes.
body. And this is
Yes.
coming from somebody who used to run marathons and would push herself to ridiculous levels. And now it's like I've reached that season in my life where it's about being healthy. It's about,
Maybe yoga today instead because you're
exactly,
still moving, you're still contributing to your health.
correct.
For menopause, they highly recommend things like yoga and Pilates and, like weight training or any of those things in a variety is actually good for you. So
Absolutely.
you're still contributing to that well-being and it's still movement, but maybe you're not feeling that like
Well,
crazy cardio today.
not even just crazy cardio, right? Because, with your declines in estrogen, you can have like a higher inflammatory response, and
Yeah,
so your joints may hurt more, or, and you don't,
like mine. Like,
yeah, I
that's-
mean, and you don't want to tax your body to that same level that you did previously, and that is
that's
okay.
a very important point.
And
That's
like,
like knowing your limits, like knowing your boundaries, knowing that, which is another buzzword that people I think have a hard time understanding, is a boundary. It's physical
yes.
and a mental boundary. So,
Yeah.
and yeah, that's okay. And that's actually probably better for you than trying to push yourself into an unrealistic expectation.
And what works for you isn't necessarily what's going to work for me. Like, I work out weight training 2 days a week, sometimes three, 2 days with the training group that I do. And then I will do usually a third day on my own. Um, but even with that, there are some days or some weeks where I'm just like, no, I'm not feeling it today. I'm going to do yoga instead, or I'm going to row, or I'm going to do a gentle bike ride, or I'm
Yeah.
going to take my dog for a really long walk.
Yes.
The important thing is about the movement and consistency. It doesn't it's about consistency, not perfection. And I think that is a big part of this idea of permission at this point, to say, all right, I'm not going to get perfect. I'm not going to really push it to the limit, because frankly, after multiple knee surgeries, I'm not pushing things to the limit because I don't want to end
Yeah.
up in that situation again.
That is, totally understandable. And but it's just a good thing to kind of wrap your head around and to be okay with it. And it's funny because I made a joke with my assistant and I said, so if I do this HRT thing, right, and it raised my estrogen, is it gonna make me nicer? Because I really enjoy a little bit of this part of my life where I don't have to be like they talk about how like when this drops, right? Like you just have no more, the tolerance for anything. And I was like, I kind of like it. Like I'm kind of digging this
You-
whole like I don't have to be so nice. And it's totally okay. I like this place. And I'm like,
So,
so stop. I don't know if I want estrogen in me if it's gonna make me like the way it was. Like
so
just a joke. But
but it's interesting though, right? Because there was a book I read a while ago, and the woman, she was a doctor who wrote it, and she said, the higher levels of estrogen get into that caretaking role, right? Where we caretake of everybody else.
yeah.
And so therefore we might do things to make sure people like us or to really support that piece of it. And now with the declining estrogen, you don't have that in you anymore. Lots of women
Exactly.
that I talk to are like, I just don't have it anymore. I don't
Yeah.
have the patience. I don't, whatever. And I'm sure you will remember this growing up. We had the Just Say No
Oh,
campaign,
yes.
right? So I'm actually in the middle of writing a blog. It'll probably be up by the time you publish this, but it is about just say no. If you are reading this, those words will resonate with you. And
Absolutely.
this point in your life, it's okay to say no and to set that
Yeah.
boundary and for
I
whatever it
totally
is,
agree.
where you're not necessarily, I'm not saying be awful, but
But if it does not serve you or you don't have the capacity
you just say
or it's
no.
crossing a boundary, I think it's perfectly acceptable. And I always said that's why I joked with her because she's the yes person, I'm the no person. So like, but especially, and it's of course gotten worse, clearly. But I was like, I wonder if I was always low on estrogen. I'm starting to wonder if like that was because but that people pleasing thing, it does literally like drift
It
away.
does drift away. And
But I'm not sure I want it back. Is what, like I
no,
was joking
no,
about like
no.
if they give you if they give you
Yeah,
the
it's not
estrogen,
coming
is it
back.
ever coming back? Because I don't want it.
And I think you can find a happy medium,
Yeah.
but yeah.
Yeah. It was so like a little questions that we have about, I find it perfectly okay to ask questions about pretty much everything. I read that women age faster without the estrogen.
Well, yeah, and it makes complete and utter sense. I mean, estrogen affects cells all throughout the body, right? So it has an impact throughout your body, all these different systems, organs, you name it.
Hmm.
And so if you remove something that has been protective or, having a positive effect, of course it's going to decline at a more rapid rate. And I was reading an article about a doctor who's been doing the female genome, and his estimation is that women age in menopause twice as fast as men. Same age, twice as fast. And
I feel like if you add the stress components on top of that,
well, and
is that
so
like 4 times as
I'm
fast?
I'm sure it could
Like,
be.
could it
It
be
it could
like,
be because stress, and that's a whole nother topic.
yeah,
But stress can also age you dramatically. But it's
yeah.
also, the lifestyle we choose to live, what we put in our body, and how we deal with the things that come along with perimenopause and menopause and
S-
postmenopause.
and we hardly ever talk about post, which
That'll be a whole
that's a
separate
whole
topic.
other thing. It is, but it comes in my head and I have to say it out loud. So the looming questions,
Yes.
HRT.
Yes.
First of all, let's for anyone who does not know, has not Googled, hasn't done any research, what is HRT?
So it can be viewed as HRT human could human
We're
could see this
perimenopausal.
is why hormone replacement therapy or menopause hormone therapy and MHT is
Okay.
also out there. So this is the concept that you will use hormones to help give the body back some of what it needs to function well. The primary one is estrogen, followed by progesterone, and then we will talk about testosterone here in a second. So, estrogen in particular has a lot of positive effects on the body, bones, cardiovascular health, you name it. And the idea of giving some of it back was to help protect the body from the negative effects of having the
Yes.
depletion. Does it mean that you have the estrogen levels
Thank you.
that you
That's
used to have? No, it
I
does
like that you
not.
said some because I think the
Some.
misconception is that it's everything's going back to normal.
No, everything is not going back to normal. And the idea is with all of this is what can we do to help keep things from deteriorating worse? Like
Yeah.
where is that threshold? And there are guidelines out there on this in terms of dosing and what people's levels are on their labs when they're dosing, all sorts of stuff. But the idea being that less is more, right? So let's support the body's natural functions, help kind of mitigate negative repercussions from these declining hormones, but not give so much that we completely alter the body's natural state of things.
Okay.
So
Okay.
estrogen helps with things like the fatigue and the brain fog and a lot of the mental symptoms. But progesterone and hot flashes, progesterone also does. Progesterone is also more of a chill pill and it helps you sleep better. And, as far as bone health, muscle health, all that, estrogen is part of that. Skin, you name it, vaginal health. Like just because you're on supplemental estrogen doesn't mean that you're not going to experience other symptoms like more creepy, like menopause
Hmm.
face, or you're on it, but it doesn't mean that it, like we said, is going to magically
Magically.
make
Yeah.
everything better.
There's that instant gratification thing.
Yeah, but it will make a lot of things better. If that's
It's an
what's
improvement.
it's an improvement. If that's what's appropriate for you. Um, the question out there is testosterone. There is testosterone therapy out there, off-label use for women. Part of the challenge with that is the fact that some practitioners, it's the wild, wild west of dosing. And
That does make sense.
and as a consequence of that, there aren't many studies out there that I'm at least aware of that really look at the long-term effects of testosterone dosing in women with guidelines on particular dosing at different stages based on different lab values and all of their
Okay.
underlying health risks. So, in medicine, it's do no harm, right? That goes back to when we were looking at the Women's Health Initiative and the idea that hormone replacement therapy took a really big hit because people were concerned about causing stroke or causing blood clots or causing breast cancer,
Yeah. Oh, yeah.
endometrial cancer. Like nobody wants, nor would it be advisable to ever give somebody something that could have such a tremendous negative effect on their lives. And estrogen and progesterone are more studied in women. They're the predominant hormones anyway, than testosterone. We do have testosterone women, and
Yeah.
it plays a role in libido. It plays a role in bone health. But I have seen scenarios where testosterone levels were so out there on the labs, and then talked to practitioners that looked at these labs when we're working with a
Mm-hmm.
particular person, and because they had a whole host of issues. Um, and the client said, "You have my permission to talk to them." Like, what's going on here? And basically, it was like, well, those were the levels when this person came from another practitioner. They never should be that high.
Right, right, right. Okay,
And
yeah.
I
So it's
ceasing
kind
it
of like anything else when it's the Wild West,
when it's being
you
used in
know,
off-label use.
yeah,
You got to
then
be really careful, and it needs to be properly monitored. And I'm not saying that off-label use for testosterone is not appropriate. I'm not saying it's appropriate or inappropriate. I think, and this, by the way, holds true for all
I was
HRT.
gonna, yeah,
For some people, it is not appropriate.
right.
And that could be based on your health history. When I had the conversations with my doctor, I have breast cancer in my family. I've had
Mm-hmm.
two
Mm-hmm.
biopsies myself. And, I had to have very distinct, it's like conversations with multiple practitioners to stratify my risk factors
Right,
if
right.
I wanted to bring estrogen into the mix, because I was already doing progesterone. And it was like, okay, we're going to go with the lowest possible dose. We're going to balance it with
Which
this
I think is so
progesterone.
important.
It is important. And there are elements where, depending on the person, it can be actually protective, depending on what type of cancer. But again, everything, you have to look at somebody's health history, what is appropriate for them, what is not appropriate. And even with that, like, you know, like anything, you've got to weigh the good and the bad
And I don't think it's
potential
a
outlay.
bad thing to start on a low. I'm very skittish when it comes to stuff. So I was like, I want the very lowest thing that you could possibly do. Let's start
Yeah.
there. Um, DHEA. Like I'm like, let's go low, low, low. Like like what is the lowest that we can do? Let's try that first. I'm always because I mean I barely take Tylenol. So I'm like, I don't like side effects. I
And
already
that's
have it. I'm already feeling enough
and that's
symptoms.
the
Like, let's
thing,
not add to this, right?
is that some practitioners will start very low. And this is the other really crazy thing with HRT, right? As you're going through perimenopause, you may have a low dose, and then one day your hormones go way up, and now essentially your levels are higher, and then the next time they're way down, but the
Yeah.
dose of your supplemental estrogen is the same, but you're going up and down and up and down. So you're having these other effects of that because you have not stabilized. And so, some people go less is more. Some people's practitioners that I've worked with, they hit them with everything up front, and then they're like, what is going on? I'm like, maybe you want to have a conversation about backing off. If this
Right,
is,
right.
if you feel like you're having negative after effects, maybe you need to cut the dose that they started you at, because maybe it's just not appropriate for you and your
And
body.
that's normal for one thing not to work for one person. There's no like
No,
standard,
no.
and we're all our compositions are completely different and how we react to things. I don't I again I'm going to always go back to this requires you to be aware of how things are affecting you. We go through our day to day, almost keep a journal, do something to, with every single thing that you're doing to become aware of ourselves and our bodies and what it's trying to tell us so that I need to reach out to my provider or whoever to ask these questions and ask questions. they never hurt.
No, and this is where being your own advocate comes into play and really understanding your body. You understand your body better than anybody else, and it is always speaking to you and talking to you. And if you have changed a variable, maybe you've started HRT, maybe you haven't, I don't know, and you suddenly, or you're taking a supplement or something, and suddenly you're experiencing really odd effects, that is the time to be having conversations with practitioners and understanding
Yes.
that, what is happening to you is real. Don't dismiss it, because there is no
I
one
really don't
size
feel
fit.
like some of that is a place to push through.
No,
Like, I don't
no,
think,
but
like,
but
if you're having bad side effects from something, like if you're having stomach pains or anything,
well, a
really.
lot of times what I have experienced with some women that go on to HRT, um, and they haven't, and this is the other thing, right? It is really, and because your hormones are always fluctuating as you're going through this part,
Yes.
your practitioner, when they're looking at your values, it's not a singular test that they're looking at. They have to test multiple times, and time has to pass, and you've got to kind of give and take with what works for you and figure out what is at the root cause of whatever you're experiencing. I think one of your questions was, is there a blood test? Well, yes, but there's multiple. You can't, as you're going through perimenopause, that period of time leading up to that being menopausal, which is a year without your period, you're, depending on when they take your levels, they could be any number of places. Like,
Oh, so and we brainstorm all the time. So, um, what it was a very common question that people have to determine if you're perimenopausal. Does that actually your levels? Yes, I get that. If you want to
it's
go to HRT, but
you
people have been told by insurance or whatever that is in order to be diagnosed as being perimenopausal, like officially, there's a blood test that's required to do
well,
that.
it can't be a singular blood test though.
Well, hence why I'm like, just ask the questions because I'm like, I don't.
You've got to ask the question, and the problem is that typically you're not dealing with just one singular test. One test at one period of time, and this is, I'll use blood sugar, right, as a
Mhm.
great example. If you test my blood sugar first thing in the morning, it might be one level. By the afternoon, after I've eaten a few meals, and depending on what those meals are, it might be a different
Oh
level.
yeah.
Your hormones are fluctuating during that perimenopausal state. So you can't, that's where it's you might be able to test once and somebody says, well, my levels were within range, because even when you're having your regular cycle, they're going to be within a certain range depending on when you are in your cycle.
Exactly.
Your levels change. So you can't, it's not just a blood test, it's what's happening with your cycle, it's your other symptoms. It's not, it's my, and I don't diagnose, I that's outside my scope, but it's not a singular, like, I don't know, thing that
Like you
if,
get your blood tests almost like you peed on a pregnancy test and it's positive or negative. You're
yeah,
either in or out.
yeah, it's different. You're
I was
not
like,
a
I feel
little
like
bit
it's a lot
pregnant.
more complex than that, but if you're in that age range already and you're having the symptoms, and because there's so many different levels, like you react to perimenopause different than me, everything is so different. I mean, I kind of feel like it's a pretty good guess that, if you're in this age range, you're experiencing these symptoms. Now, you want to get all of that other stuff checked out too, but it's not like a pregnancy test.
Yeah, and don't get me wrong, they can definitely look at levels and determine, based on that and the fact that you haven't had your cycle, that you are in menopause. They, you know, like,
Oh, yes,
yes, you
yes.
know what I mean? Like you
And
are
Perry can be for 10 years. So, like,
right.
if you're at
Y-
40, it's
You,
very possible that
you could be
you're
having
getting there.
fluctuating levels.
Yeah.
So it's not, that's why I say like it's a little bit different. It's not a singular, you know, because if you look at even your labs, if you get your hormones tested, they'll say based on what phase you're in, and then they'll say like postmenopausal, whatever. It'll give different ranges, but you know, you could have somebody that is in a certain phase and their levels, they're still getting their cycle. So depending on when you take it in your cycle,
I
it's
feel like
going to
there's
hit a different
so many
way.
nuances
Yeah, there
to
are.
this.
There are. It's not just one thing.
It's mind-blowing, you know. So what can we do about this? And I love this. This is my favorite part whenever we start talking about holistic treatment. Um, because honestly, I feel like you can do the HRT and you can absolutely do this. I think it just makes life so much better. What can we start doing from a holistic standpoint? And if you haven't done it, I always say making just a couple changes at first and then a couple more changes is always how I like to encourage people to do that. But let's talk about these. Like,
Gosh,
what are the most, there's so many. I
there's so
know.
many. So, couple key things to keep in mind when you are perimenopausal, heading towards menopause, or maybe you are now menopausal. When you are looking at general health, one of the things to keep in mind is weight gain is an issue. And I blew a client away when I said, you know, she's like, well, I want to lose weight. And I said, well, the normal guidance is like, aside from food composition, 500 less calories per
Mhm.
day than whatever to lose a pound a week. And I said, the problem is that figure is out there. And then if you are in menopause, it's your base rate is lower by 200 to 300 more calories. And she's like, so you're telling me I basically eat nothing? And I said,
Pretty much.
this is the problem that is out there. Your metabolism changes. So for anybody getting ready, like getting ready to go into perimenopause, um,
It's
the
not as fun
idea
as it sounds.
the idea of going into that and really being in a good space with your health and well-being, I'm not, weight is a number as far as I'm concerned, because
Yes.
it can mean any number of things depending on how well you're taking care of yourself. But you know, really focus on going into it in the best, healthiest possible space that you can. So, the other thing when you're in this perimenopausal, menopausal state is that with declines in estrogen, you aren't as sensitive to insulin anymore to, and that creates a level in insulin resistance. People have heard
Mm-hmm.
of that. So people can develop blood sugar problems if you have higher levels of, you know, circulating blood sugar and insulin, etc. Now you've got an additional challenge to losing weight, right? And I
Right.
bring weight up not because,
I feel like
again,
it's the number one.
it's a question out there, but it's like that does factor into things, right? That insulin sensitivity is really, really, really important, because not only does it affect your blood sugar, now we've got cholesterol involved. Declining
Yes.
levels of estrogen also affect cholesterol. And so you're increasing your cardiovascular risk. So it it is a multitude of things. The other thing, as far as lifestyle is concerned, I know we're going to talk about stress on another day, but when you aren't sleeping, which is also a part of perimenopause, you increase your stress levels, which increases your cortisol, which affects your blood sugar, like all the things.
Which
It's a
makes you hold weight, especially around your
belly.
belly.
So there's that.
Yes.
But when you are not getting enough sleep, it also affects insulin sensitivity. So you're already kind of at a challenge anyway. And then you're not sleeping.
Yep.
So sleep is a huge piece of this puzzle. It also affects hunger and satiety hormones. So and not in a good way, by the way. Like the idea that you would want to eat a bag of chips and then the next thing you know, you've already eaten the bag of chips and you haven't like stopped yourself. That is
Yeah.
out there. That's a
Yeah.
real thing. So
It is
what can
real.
you do? The best thing anybody can do about any of this, also muscle mass loss, is get out there, take care of your bones, exercise, do weight bearing exercises if it's appropriate with you and your doctor's clearance and whatnot. It will also help you sleep better. One of the biggest things that is out there that I find is really focusing on like a Mediterranean style diet. And by diet, I mean, don't go, this is not like the South Beach diet or the keto diet or any of those things. It is just dietary intake, because it is low inflammation. So it's a low inflammatory diet. It's going to be high in fiber, which you need as far as
Yes.
not only your gastrointestinal related issues, but also for things like blood sugar and cholesterol and all the things that you're kind of facing. It's the most studied dietary intake for longevity, because at this point, this is what we're talking about, right? Like, how can we optimize our health and well-being for longevity, and reducing inflammation? Because when you are inflamed, it's going to make all the other menopausal symptoms that much worse.
It absolutely does.
And
I can attest to that.
Bringing in cruciferous foods, so your broccolis, your cauliflower, your kale, your Brussels sprouts, things like that, they help with the detoxification pathways. So, in terms of detoxifying the levels of estrogens that we don't want, we want to make sure that we are eating the foods to support those things.
Of course.
These are all the general things that you can do. Being active is also really important, not only for your cardiovascular health, but also to bring that blood sugar down, dealing with cholesterol.
It helps your mental health.
And it helps your mental health, and it will help you sleep. And sleep is really important because, as we were talking about when I first started saying things, the sleep is kind of the root of all of it. And anybody who knows me, I'm a like 8 to 9 hour girl. If I get 5,
I'm done for at 5.
You just you better watch out.
Yeah,
because I'm not
I'm so irritable at 5.
But that affects your mental health and well-being too.
Yeah.
So outside of HRT, if you're just talking like diet and lifestyle, those are the things that need to be pursued to really kind of support the body, because you want to be low glycemic. You don't want to do a lot of refined carbohydrates.
Right.
Not only are they inflammatory, but you're already dealing with a lower metabolism and higher potential blood sugar and lower insulin sensitivity and all those things.
So it's just like adding fuel to the fire.
Correct.
If you do it. I mean, those are all things that we should be doing anyway.
They are,
but at this point, it's like a necessity.
Yes.
It's a necessity.
And estrogen, especially, like when you look at it, people talk to me about fasting and whatnot. That can play a role depending on the person. But if you are so stressed out, fasting is not going to work well for you, because you're going to stress your body more. Keto, same type of thing. You can stress your body more. So, this is where you've got to really understand what is going to work best for you and your body. Avoiding things that might trigger making those hot flashes worse. Nicotine, caffeine, alcohol, high histamine foods or histamine releasing foods. Like all of these things can make those symptoms actually feel worse.
Yeah.
And you want to kind of move away from that. But and by the way, alcohol metabolically not great for sleep. It will disrupt your sleep. Yes. People think, oh, I'm having a glass of wine, it makes me sleepy. Yeah, but it's also going to disrupt your sleep later on, which is why many people wake up in the middle of the night and they have real problems. And when you drink alcohol, your body is going to prioritize metabolizing that over anything else. So if somebody is experiencing menopausal weight gain, it's going to be more difficult to lose weight if they are on this cycle
Well, if
of
you're drinking
caffeine
alcohol, you're
and
going to be eating some garbage too. I can almost guarantee it. You're
possibly
not eating bell peppers with
no.
your wine.
No,
No.
but I find a lot of women come to me and they're doing a couple of glasses of wine at night, and then they, by the way, that's also n- not great for your hormones, but they're doing a couple of glasses of wine at night, then to wake up in the morning because they're not sleeping well, they're doing a bunch of caffeine. That's going to heighten your stress
Oh, yeah.
response,
Yeah.
and then you're creating this like, and then you need to come down from that because you're really just on edge all day. So it's really finding out where that balance is for you.
Yeah.
The other thing that I would put out there, just natural solutions are, cognitive behavioral therapy has shown to be really helpful when it comes to working through some of the symptoms, as far as like the hot flashes and maybe some of the irritability and things like that. Knowing that, okay, this is only going to last for a hot second and then I'm going to feel better, and I just working through it because they've shown that to be successful for bringing down the, some of that kind of feeling. I do get asked about supplements. You can eat as much soy product as you want. It's not, to my knowledge, I have not seen it change the needle on, in comparison to like HRT.
Hmm.
If you eat a bunch of soy all the time, it's not going to necessarily mean that you're going to have the same levels as somebody who's doing an
Gotcha.
estrogen patch.
Gotcha.
Like they're just not. But that's not to say that you can't eat soy rich foods, but you got to like look at kind of what's appropriate for you and whatnot. There are supplements out there. L-theanine is a supplement. And again, I'm going to say this disclaimer, any supplementation that anybody does, not any one supplement is appropriate for every person. You've got to really work with a practitioner to make sure that it's appropriate for you. If you're on medication, really anything that is herbal, even though it's natural, just like grapefruit can impact how somebody's medication is
Yeah.
metabolized,
Yeah.
these supplements like the Vitex or the chasteberry, or
Hmm.
you've got the maca or the black cohosh, any of these things can be very helpful for people. But if you also have some type of medication, you need to really be mindful. And I have seen people that do supplemental combos of things, and then their liver enzymes are all over the map. So
Ah, that's good to know.
you
It's
gotta be
good to know to
careful.
be,
You just have to be
yes.
careful. L-theanine is really good for your mental state as far as like a chill pill. It's good.
Magnesium helps me with my joints,
And
and I absolutely
magnesium,
love that.
or even if you don't want to take something in like that, soak in an Epsom salt bath.
I know we always talk about that. I actually use powder now, v- like versus a pill.
Yeah.
It goes in quicker. I love the Epsom salt baths
Yeah.
too. Like that
So
works.
the other thing to kind of keep in mind, if you are on HRT, you also should be mindful of what's happening with your nutrients, as far as your
Absolutely.
B vitamins and things like that. And because that can affect your neurological function. So just like if somebody's on birth control pills, they can have alterations in B vitamins. It's not a stretch to take a step back.
Being aware again is what you're saying. All of like it's, but that's it's all different for this person versus this person. What works for
Yes,
you, and um, I think all of the wellness things are important. Meditation, doing things that support your well-being,
yeah,
um, taking time, and rest just isn't sleep. It's also like doing something that kind
yes,
of like, I don't know, fills your cup. those are all things that we don't take time in our lives period for.
Correct.
Now I think is the most optimum time to be like doing something that kind of feeds your soul.
Absolutely. And then the other thing that I will point out to people, and this is not necessarily like on the complete holistic side of things, but know that, well, parts of it are. So, recognizing that what you take into your body very much affects how your skin looks and feels and whatnot. So, eating your nuts
Yes.
and seeds, those essential fatty acids, being properly hydrated. If you're talking about something that isn't on the holistic realm, but in the hormone realm, they do have estrogen based topical facial creams that it can help with elasticity and it's topical. Now, again, that is got to be viewed as whether in the context of what is appropriate for somebody,
Yeah.
because it is a topical, it is something that is out there. Some people need to use supplemental creams vaginally. I mean, it really just depends on the person, what's appropriate for them, and that's why you discuss these things with your physician.
Yeah, exactly. And I don't think it's a bad thing to do your own research if you need assistance. I mean, you work with people all the time that are in this range and stage of their life, if you will. That's it's not a bad thing to need someone to kind of coach you through it.
Well, and this is where I think when you look at the fact that there is so much information out there, it can be very overwhelming. It can be confusing. And, you know, this is where going to somebody who's a professional who can look at the bigger picture and look at the bigger picture with you at its center to
Mm-hmm.
figure out what is appropriate for your case, your family history, the context of your life, and then helping you navigate what you can change, because what worked for you even 5 years ago isn't
It's
what's going to
not.
work for you now.
We
And
talk,
that's
yeah,
okay.
and that's the same with anything, like your career, your life, your growth. It happens.
Yeah,
It changes and it evolves, and we have to evolve with it, or it's gonna
absolutely.
really suck. Like, I mean, like, it's just
Really
to put it
suck.
bluntly, if we don't evolve,
Yeah.
but there is help out there. And if you're struggling with that, like, I would never hesitate to recommend somebody to help you, whether that's a class or whether that's a program or whether that's a practitioner that does that type of work. I think it's okay because it's a really confusing and difficult and overwhelming time.
The other thing that I did want to point out is sometimes for women that have a history of like breast and ovarian cancer, and it's just not, hormone replacement therapy is not appropriate for them, right? It's just not. Um, for those individuals, they do, there are other medications out there that are available and can be discussed with respect to your doctor to help you
Right.
know, help you minimize. It may not minimize everything. I mean, because you think about bringing estrogen back, you're not bringing back to where you were when you were 25, but you are replenishing pieces of your body's natural function. So you're going to hit a multitude of areas. Some of these other methodologies are more targeted towards like the brain, neurological function, things
Right,
like that,
right.
or whatnot. But again, this is going back to having that conversation with a practitioner to determine based on you and your medical history what is appropriate for you and your situation.
And of course, that's very important. So thank you so much again. And we will be doing a part 4. So you guys, thank you guys for being here with us. If you're watching on YouTube, would you please like the video and subscribe to our channel because it is super helpful. And you can also find us on Apple and Spotify. And I cannot wait to see you next time here on All Things Pink.